The Sinai Medical Foundation project is being conducted by the Leonard N. Simons Jewish Community Archives. My name is Robbie Turman. Today's date is November 22nd, 2023, and I am interviewing Dr. David Schwartz. Dr. Schwartz, do you give permission to the Leonard N. Simons Jewish Community Archives to publish, duplicate, or otherwise use this recording for educational purposes or for uses deemed appropriate by the archives?
I do.
Okay, thank you. Let's start with when and where you were born.
Well, I was born in South Africa, 21st of October, 1941, in a little town or farming village called Heidelberg, which is in the northern part of South Africa. My father was a family practitioner, and he was assigned to work in that part of the country during the war. I lived the first part of my life, up to the age of 5 or 6, was in Heidelberg, and then we went to the United Kingdom, where he was specializing, and then we went back to South Africa before moving to Johannesburg.
And was it your father who inspired you to become a doctor?
Of course, he was one of the people. He was a wonderful guy, very compassionate, very admired by the patients in the community, so obviously that is an influence on me, and he continued to be a positive influence throughout my life. But my family, on his side, were all doctors or dentists. So I was exposed to medicine a great deal, and of course there was business as well, but it appealed to me, and he was one of the most important people in my life to influence me to do medicine, yes.
Did you ever consider any other career or just medicine?
Well, I was considering other careers before I made the decision. There was business. My grandparents had come in from Russia many years ago and started their lives in the late 1800s, and then eventually developed and created a brush and broom manufacturing business. So I had the opportunity to go into business, but it wasn't something that appealed to me.
Can you talk a little bit about your medical school education?
Yes. I was educated. After my high school, I went to the University of, it's called the Witwatersrand, or for those of us who come from South Africa, it's called Wits. In Johannesburg. It was one of the most progressive, forthright, and I think illustrious medical schools in the country. I was fortunate to be admitted to that university, and that's where I did my medical school training. It's a 6-year program, it's the British system, unlike in America, and I completed my medical school training there, and then went on to do an internship, general internship in surgery and in medicine, and after that in obstetrics and gynecology, and then went on to my specialty field residency in OBGYN in Johannesburg.
And can you talk a little bit about your specialty, why you decided to do it, and a little bit about that process?
Sure. In the middle of my training, we were assigned as medical students to go to different hospitals. Some of them selectively for certain things like an infectious disease hospital, etc. One of the hospitals I visited was an obstetrics hospital, just delivered babies, and I was assigned for my month rotation to spend time just delivering babies, taking care of mothers and the babies. And to be quite frank with you, I had an epiphany, and I said, well, this is what I want to do. So to be quite sure, I went on a further elective to an underprivileged hospital in Zululand called Edendale Hospital. I spent another month there and had a wonderful experience, and that cemented my decision. So at the end of my training, that's what I wanted to do, and I became an OBGYN. However, like many of the physicians who I trained with, we were exposed to attendings who had gone on for further training outside of the country. They'd either come to the States or gone to England. And following on their example, I decided at the end of my residency to go to England. I was fortunate enough to go to Oxford University and work with the head of the department there, Sir John Stallworthy. He was actually a cancer surgeon, which is what I wanted to do at that time. But when I was there, I got exposed to a new field called maternal fetal medicine. There was a Dr. John Bonner, who was a leader in the clotting studies involved in pregnancy, as it is affected by different conditions, and I became fascinated by that and decided, no, that's what I wanted to do. So I came back to South Africa and spent some time, full-time service at the university on the faculty, and then in private practice before immigrating to the States, because in the States, it's the only place you could get formal training and certification in this field of maternal fetal medicine. So that was late 70s.
While you were practicing in South Africa, it was also the time of apartheid.
Mm-hmm.
Did that affect your decision to leave the country?
Absolutely. I'd made a decision to leave the country most of my adult life. I think I was influenced by the inequities of the system, as were many of us. And my father had always encouraged me to go to America if possible. So after the 1976 riots in Soweto, Soweto is a name given to an African township called Southwestern Townships, where there was a lot of terrible violence. It sort of sealed my decision to leave. And so I then sought out alternative positions around the world and was fortunate enough to be able to find a position in America, and decided that I would like to take up that opportunity, and was fortunate to have a sponsor in the Department of OBGYN at the University of Wisconsin in Madison, where if I came across to be in their faculty, they would allow me to do a fellowship in maternal fetal medicine. So I had two things that were going for me. I had a fellowship in maternal fetal medicine and also a place that would give me a green card, allow me to practice. I was fortunate that I didn't have to redo the exams, at least to redo a residency. I had to redo my examinations to become board certified here, which I did. And then I did my fellowship and completed the fellowship in Wisconsin in the early 80s. Yeah.
And how did you get from Wisconsin to Sinai Hospital of Detroit?
Well, that's an interesting story. I think some people may be interested in the connection. I was looking for, after I'd been on the faculty for a few years at the University of Wisconsin, I was looking for the opportunity to lead a division in MFM. It's called Maternal Fetal Medicine. And I was approached by Dr. Milton Goldrath, who had a very good friend of his who worked at the University of Wisconsin. His name was Dr. Ed Ehrlich. Dr. Ed Ehrlich was in the Department of Nephrology, Kidney Diseases. He and I knew each other. He knew I wanted to leave. He contacted Milton, and Milton came to see me and said, "Why don't you come and have a look at a position we have open at Sinai Hospital of Detroit?" So I visited here and found that there was a very warm and welcoming group of people. Milton and his wife, Joan, were very good to me, as was Alfie Sherman and his wife, Sandy. They were the two of the leading physicians in the department, and they encouraged me to come here. So I visited here a few times, saw other people like Dr. Seymour Ziegelman and Loretta, Jerry Weinberg and Didi, so the people whose name may be familiar to people here. But it was a big department, and it was a well-developed department. It had a great reputation. And I think one of the reasons I came here to this sort of hospital was because in this country, you had a range of hospitals that are not available outside of the country. You have hospitals that are purely run by universities or state or public systems, and then you have private hospitals. And some of the private hospitals, such as Sinai of Detroit, were affiliated with the universities, had their own independent residency, so there was the educational piece as well as the academic piece and the private practice piece all merged together. So it was very attractive. And so I made the decision to come in and join the department, and it was one of the better decisions that I made. I was very happy to do that.
And what year was that?
Moved here in July of 1984.
And were you married at the time?
Oh yes, absolutely. My wife, who had encouraged me in moving to the States, we moved together, and she encouraged me to take this position. And we came here with one child. Our youngest daughter was born in Madison, Wisconsin, in 1980, and our second daughter was born here subsequently in Detroit. Yeah.
Can you talk a little bit about the atmosphere at Sinai when you first started, what the culture was like, what the atmosphere was like?
Right. Well, I think that one of the things that drew me to the hospital was a very positive an exciting atmosphere that existed in the whole department and in the whole hospital. It wasn't just unique to my department. You know, the hospital, as everybody knows, around the country, there were many hospitals that were started because Jewish physicians and Jewish professionals were unable to get effective positions in other hospitals because of prejudice. So across the country, both on the East Coast and the West Coast and the central part of the country, the Jewish communities were able to start their own independent medical institutions, which was a boon for people to be able to practice there and enjoy their professional lives. And there was a lot of cohesion, personal commitment within departments and between departments amongst people who shared this sort of background. It wasn't only Jewish patients, at least Jewish physicians. There were lots of non-Jewish physicians as well. But I enjoyed the spirit of excellence, the commitment to patient care, which was very intense. The commitment to valuing the system of care for patients as well as the educational piece. I think all the physicians were interested in becoming better, so they kept on searching for continuing education for themselves and encouraged that to be developed within their departments. And as a result, within the departments at Sinai Hospital Detroit, I know there were some very wonderful innovations that occurred in all the departments. And that sort of kept the spirit of excitement going as well as the spirit of intense excellence within the department. So that's the sort of feeling that I had when I came in, a commitment to continue to practice well and to continue to develop yourself, train younger people to become excellent physicians. And it was a palpable sense of camaraderie that you experienced when you came to that hospital.
As a Jewish doctor, had you faced any anti-Semitism in any of your earlier positions?
Well, not directly, but indirectly, because I think that, you know, unfortunately, anti-Semitism is nascent. It may be under the surface. I never personally experienced it myself, but I was aware of colleagues, close friends who had been exposed to discrimination. It was a sense of great comfort when you're practicing in a hospital, you know that it's not going on there. There's no discrimination against anybody. And that was really quite a comforting feeling for me, and I'm sure for many of the other physicians.
What positions did you hold while you were at Sinai?
Well, when I came to the hospital in 1984, I started off as the division director or section chief. It's the same thing, just different names, of our division of high-risk pregnancies called maternal fetal medicine. There'd been an individual who had been there before me, John Goldcrand, who had started the initial development of the division, but it was something that was rather elementary. When I came to interview and spoke with Irv Shapiro, members of the board and members of the department, they wanted to develop a complete department and a complete division. So that was my initial task, was to be a division director and develop all elements of that division. Subsequently, I became chair of the department. Milton Goldrath had been the chairman. He was part-time, he was in private practice. And for many years, the department had functioned with part-timers or private practitioners. There'd never been a full-time group of attending physicians in the department. So I was probably the first full-time attending physician who became a chair. I became the program director as well, and then I relinquished my position as a maternal fetal because I recruited people into that division, and I gave them the responsibility of running the division. And towards the end of my career, of my time at Sinai, I was fortunate to have an endowed chair in perinatal medicine, the Sreri Chair of Perinatal Medicine, which was endowed by the Sreri family in conjunction with the Detroit Medical Center and Wayne State. So those are the sequential positions I took. And then just before the hospital was sold, during the transition, I shared the position of Director of Medical Affairs with Eduardo Phillips. I took on some of it, and he took on the rest of it. So over the course of the 16 or 17 years I was there, I moved through a number of different positions that I was happy to serve in. Yeah.
Were there any issues working there as a full-time physician versus the people who came in from private practices?
That's an interesting question, because I think there's always the concept that there's a tension between private practitioners and full-timers, because there's a concern that people will take business away or steal patients and not send them back. But I'm pleased to say that at Sinai, especially in our department, and I believe this occurred with all the other departments, that the people who in the full-time practice collaborated with and were supportive of the people in private practice. The traditional model that existed the decades before I came was for private people, private practitioners to run the department. And everything occurred under the egress of private practitioners. But as the requirements for educational training became more rigorous and demanding, it became too much for people in private practice to do that. And also, as I became subspecialized, there were new subspecialties in my field, in cancer, infertility, and then urology. And so you needed people with additional skills and training, and they became the full-timers, and they collaborated with, and I believe did not take away from the private practitioners. And I think the testament to that in our department is that we grew. We attracted new practitioners. They weren't frightened to come and practice in our department. They felt it was a worthwhile experience and good for their patients, good for them. So I think that tension did not really exist in our department. I was aware of it in other parts of the world and other parts of the country, but I don't think it existed at Sinai of Detroit.
You mentioned some of the innovation that was going on at Sinai Hospital. Can you
Yeah.
talk a little bit about the innovations in your department and how you were involved?
Yes, I had some wonderfully talented physicians who were working in our department who needed to have the support to develop their special interests. And these interests were directly related to patient care. Some of them were related to administrative issues that were innovations within our field. Well, firstly, we never had a special section of gynecology, so when I became chair of the department, I appointed Milt Goldrath as the section chief of general gynecology. Now, Milton was a very smart man, had a lot of interesting ideas, and he piloted and then developed a wonderful innovation called laser ablation that was used for laser ablation of the endometrium, which is the lining of the uterus, to help people with bleeding disorders. It became the standard of care around the country and around the world. And he introduced the system because he worked with people who had laser surgery techniques. A lot of that came from the Department of Ophthalmology. And that will be talked about independently, where it had been developed. I think there was an individual, his first name was Terry, I don't remember his last name, but Terry had worked with Milton to develop the laser ablation techniques. And then that is extended to other aspects of gynecology, which I'll talk about in a minute. But subsequently, Milton developed a simplified system of endometrial ablation, because laser ablation is very intensive. It requires an individual to use the laser to do the procedure. But to make it easier, he developed a technique where he used hot water that you could heat to a certain temperature, which could be used by anybody shouldn't by anybody, by a board-certified physician without special skills, much easier to use. It was equally effective. It's called hydrotherm ablation of the endometrium. He published that, he developed it. We helped him do the initial work in our department. I gave him the opportunity to work in the pig lab. We had an endometrial lining procedure done with a pig model. And that's where he refined the technique and developed it. And that was a major innovation for not only patients in this area, but around the country. The laser ablation technique was also used by another individual called Richard Reed. Richard had been in the department, and we helped him develop his technique for using this to get rid of precursor cells for cancer of the cervix. And he used this very effectively and used it for other aspects of cancer treatment and pre-cancer treatment. And I mention this because in order for people to learn this, we had to provide them with the opportunity to practice it. So for many, many years, we ran a teaching lab down in Sarasota in Florida, where we got people from all over the country to come in and use the laser surgery equipment with an animal model and a vegetable model as well. You can use different types of fruit for your procedures. And we ran that in Sarasota for, I think, about 14 years. We used to have at least a couple of hundred people, 200-300 people come in and learn the techniques. So that was a major innovation that our department got credit for. I didn't personally do the procedure, but I was very proud of the people, and they did a wonderful job. So that's in general gynecology and in cancer treatment. In obstetrics, we developed a full division with cancer, with genetics. Recruited a young lady by the name of Robin Gold, who was the genetic counselor, and she developed a program called the Dorshurim program that worked for Tay-Sachs disease screening amongst the Orthodox community in the city, and she did an outstanding job with that. And then in terms of maternal fetal medicine, we had an ultrasound division which we developed, recruited a whole group of ultrasonographers, and it was one of the early programs in the city of having a complete maternal fetal division. Twin pregnancy was a common issue in the early 80s because those who specialized in infertility had not yet refined the ability to limit the number of eggs that were ripened for people who needed to have babies. So when they treated them for their infertility, one of the byproducts is having more than one baby. So that can be okay and wonderful for people having the children, but in obstetrics it can be a little bit of a problem. So we had some specialized techniques and programs. We had the twin pregnancy program, which had many, many twin pregnancies come through, and we managed their pregnancies, helped them to extend their pregnancies further on into pregnancies so they wouldn't be too premature. In order to achieve that, we incorporated a device that we put onto the uterus called the tocodynamometer, which went home with patients, and they would transmit the uterine activity over the phone to a central monitoring station. And if there was too much contraction of the uterus, they would come into the hospital. We'd give them medication to quiet the uterus down. That was an innovative program, which was, I think, very helpful to the patients. Diabetes in pregnancy is a big problem potentially for both the mother and for the baby. And in order to control the diabetes effectively, you need a program to help the mothers control their blood sugars. So we developed that program. We had special nurses trained in helping to guide the patients how to test their blood sugars, dietitians to work with the patients, and we had the first formally accepted program of diabetes in pregnancy in Michigan, certified by the American Diabetes Association. And we were able to help many patients get better outcomes and published a number of articles and presented the work at a number of meetings. We're one of the early programs to develop intrauterine transfusion. I'd been fortunate enough to get a sabbatical. Bob Steinberg had given me the permission to go overseas to England to learn some techniques in ultrasound and intrauterine transfusion. We introduce a little needle into the umbilical cord and do an exchange transfusion for patients who have a baby that's affected by certain diseases. And we were one of the early programs here to do intrauterine transfusion. It was also done at Wayne State at the time, and so we collaborated on that. What else went on in obstetrics and gynecology?
Well, it sounds like that department was probably bringing in a lot of patients in the Detroit area and beyond.
Yes. Well, we did. We grew the program when I came here. We were delivering about 2,400 deliveries a year, and then eventually it went up to about 4,500. So we had a lot of patients delivering at Sinai. It was excellent. One of the problems that I think I would like to one of the innovations was the malpractice crisis that struck or that occurred in this part of the world for obstetrics in the early 1980s. The attending physicians, because of the lawsuits that had been generated, I think, around the country in relation to obstetric outcomes, some of the insurance companies were having difficulty in continuing their insurance for attending physicians. And this is a real problem because if they couldn't get insurance, they wouldn't be practicing, they'd have to leave the state, and of course they left the state, they wouldn't be providers, and we wouldn't have patients. So the board and the administration at Sinai really stepped up. They came together and worked with our legal system to be able to extend an umbrella of insurance and a special arrangement that was quite legal for all of these practitioners and all the practices. There were many people who were affected. And so they were able to sign up and become employees of the system, but still retain their ability to practice as private practitioners. That was a major innovation, and I'm pleased to say that it was rescued our department because our practitioners were able to retain their privileges and work in our hospital, which is a very important issue.
What was your favorite part of working at Sinai?
Well, firstly, I enjoyed what I did intensely. I loved my work. And then being able to introduce the innovations in obstetrics that made us more effective and more efficient and expanded our scope of practice was a very gratifying thing. They gave me not only the resources to employ people in direct care, but in order to influence others, you have to demonstrate that it's working. So we had to publish and show our research. So they gave us the opportunity to hire a biostatistician and data entry clerks who would help us compile the data that we could use to translate into. So being able to do effective research, clinical research, was wonderful. And then the people I worked with, they were just great people. They were inspired by their day-to-day activities. We worked collaboratively together, and some of the happiest times of my life have been when I spent my time working at Sinai.
We've heard a lot actually about the wonderful doctors at Sinai. What about the other support staff, nurses and other people working at the hospital? How did the doctors work with them?
That's a very important question because we are not isolated. We work as a team, and it's something that I always appreciated that was instilled in me from the people that I'd worked with, my attendings and seniors and teachers. We're all part of a system. And so I think the nursing staff were outstanding. They were equally important in the patient care. Sinai had its own nursing school, the Shapiro School, which trained many young ladies to become, and men. I don't think there were many men at the time, but certainly many young ladies wanted to become nurses. And so I did our own nursing training program. They stayed on in the hospital, and we worked collaboratively together. In my own department, I had outstanding nursing personnel who worked with us, both at the ward level and the staff level, as well as in the administrative level. So it was great. It was really wonderful. Thank you.
Did you have a least favorite part about working at Sinai?
Well, sometimes administration can become a little bit cheery and boring and difficult, but no, that wasn't my least. I enjoyed my time as an administrator as well as a clinician. But I think the times that were probably least comfortable and pleasing to me was when we started to hear rumors about the hospital no longer continuing to function as it used to do before. And that was hard for all of us. So when we eventually sold and closed down the hospital, that was the preamble to that, and the years before that, not the year, the months and the year before that was not at all pleasant. It was difficult because you're working in an environment where you know that you're trying to do your best, but you know that the long-term future is very limited. So that was not a pleasant time for me or for anybody else working there, actually.
So let's talk a little bit about the sale. When did you start hearing maybe rumors that the hospital might be sold? Well, I've thought about this, and it was difficult for me to pinpoint exactly. So it's a little bit, the dates are a little bit hazy, but I think the sequence that I remember and recall, Robin, was that at one point the hospital's profitability had dropped. And there were concerns about why it was no longer able to generate the money that it used to. And so the board and the administration called in some advisors or turnaround specialists who came into the hospital, reviewed the workings of the hospital department by department,
and came to the collective decision that there was stuff that could be done to strengthen the department, to improve the operations and make it more profitable. I think for many of us, we thought that that was the objective of the exercise, was to help improve, get an outside opinion to say, what can we do better? So we need to do better in order to survive. And I think that most of us thought that that was the objective, but apparently what happened was that a secondary objective was to make sure that when it was doing better, and we did a lot better, all the departments, including ours, was to make it more attractive to a purchaser who would be able to pick up the hospital as a profitable entity to supplement their own income in their system. And that happened right towards the late 90s, I think. I can't remember exactly, was it 98 or 99? I'm not sure about that. And so we then learned that maybe this was going to be sold rather than retained. And there were 2 or 3 alternative purchasers. One was in the private industry. I think it was the Tenet Hospital System. The other was the Detroit Medical Center and then the University of Michigan. And there were talks that we heard about going on between all 3. And eventually the decision was made to sell it to the Detroit Medical Center. And of course that was where it eventually ended up, and that's what occurred.
From your perspective, had there been changes in the culture of Sinai from the time you started to the time it was sold in the late 90s?
I don't believe that the culture changed dramatically, because I have to understand when I was at Sinai, it was about a 17-year period. So there are things the changes that do occur. But certainly in our department, I think the attending physicians were loyal. They retained their affiliation. We got new practices coming into the department. And I think that from that point of view, things didn't change much. I was in a department that was I think it made money, so I think we were maybe a little bit isolated from the rest of the departments. But I didn't see dramatic changes in terms of the physician personnel. There were changes administratively. People left and new people joined. And I did get a sense towards the end that there was less of a commitment to retaining the hospital as an independent entity. And once that happens, the spirit of a place gets a little deflated, and it's hard to be enthusiastic if you know that you don't have the same commitment to excellence and to continue to operate independently. I think the physicians all were very unhappy about the sale. I don't think there was anybody in my department who wasn't initially frustrated, maybe angry, and then it's kind of like going through the stages of grief. You deny, you get angry, and then accepting. But many of them were private practitioners, and they decided, well, if it gets sold and it's not going to be good, we'll just move on. I think we were led to believe that if we were sold to the Detroit Medical Center, the focus of the northern part of the city around the Sinai region would be retained at Sinai. And we'd hoped so. But unfortunately, at the end of the day, when it was sold, the focus moved from Sinai to Grace, and they incorporated together. And of course, Sinai is no longer, even the structure is no longer, which some people, I think, felt was going to happen, and they moved on. Yeah.
And what happened to your department and your position after the sale?
Okay, so I was no longer the chairman, but I was given the responsibilities of being in charge of obstetrics for the Detroit Medical Center for the whole of the northern part of the city, included Grace Hospital and Sinai Hospital. And I retained my perinatal chair in medicine position. So I moved across with a full-time staff from Sinai to Grace Hospital. That's where we landed, and we practiced there for a while. But as time went by, people felt that it was not the whole atmosphere and the way that the practice was generated there was not what appealed to them, and they moved on. I was uncomfortable in not running a department, and so I sought other opportunities and moved on myself and moved to the Sinai Hospital of Baltimore.
And what year was that?
2000, beginning of 2000, yeah.
Are you still practicing?
Now, I retired from practice 3 or 4 years ago in 2019. But when I moved to Baltimore, I was fortunate to join the same sort of hospital. It was almost identical, very supportive board. They had funds, and so we built an entirely new women's center there, which was wonderful. I had the opportunity to work with them and do that. Developed a department, it replicated what we had in Detroit. And then I retired from that position in 2012 and went to work in the Dean's office at the University of Maryland Medical School and in the Department of OBGYN at the University of Maryland. And I worked as Director of Clinical Affairs in the Dean's office for 6.5 years, taught in the Department of OBGYN, and then finally retired about 4 years ago.
So you moved from Sinai of Detroit to Sinai of Baltimore.
Yeah.
But unlike Sinai of Detroit, Sinai of Baltimore thrived. Why do you think that is and Detroit couldn't make it?
I wish I would know the answer to that, but I can give you my own personal opinion. The board at Sinai of Baltimore was absolutely committed to maintaining this hospital come what may. They were resourceful, influential, and you must remember in Baltimore there's a lot of competition. There's Johns Hopkins system, University of Maryland system, a MedStar system, and there's some Catholic systems there, so it's a competitive industry. But they were able to see their way through to making sure they were innovative and creative. They've acquired 3 or 4 hospitals, so it's a big system now called the LifeBridge Health System. And so I never had a doubt that these people were going to let this hospital be sold or closed down. I have to be frank with you, I never got that impression towards the end at Sinai. I think people felt that it was time to sell the hospital, and many of us were frustrated because we didn't believe it was necessary.
How would you like Sinai of Detroit to be remembered?
I think Sinai Hospital of Detroit should be remembered as a very strong, effective, and innovative medical system that did an enormous amount for the health of the communities it served. Both the downtown community, the inner city community, as well as the suburban community. And it is an innovative center that created lots of new systems and creative, as I've mentioned to you, certainly in my department, but other departments as well, innovations that helped people. So I think it was a beacon of the Jewish community in Detroit for the rest of the community. And I'm sad in a way that that doesn't continue because, you know, we're interviewing now in 2023, recently. You know, there have been some very unfortunate things in the Middle East, which has in fact led to a change in the way not only Israel, but the rest of the Jewish community is considered throughout the world and even in America. I think we needed, and we will continue to need, beacons of goodwill to help bridge the gap between us as a Jewish community and the non-Jewish community. I think something was lost when Sinai Hospital of Detroit was closed. I think it was a very positive influence on the surrounding community. People felt differently about the hospital, and I believe the Jewish community at large. So I'd like it to be remembered as that positive bridge between us, our Jewish community, and the non-Jewish community, and as a wonderful healthcare provider.
And is there anything that we haven't discussed today that you would like to add?
Well, you've been pretty thorough, and I've tried to respond as best I can recall. It's been many years since I've had to think of these things, but I wanted to just say that I think that one of the pleasures of my learning and developing, as I did throughout the time I was at Sinai, was the opportunity to work with other departments. Each of the leaders in the other departments were remarkable individuals. I remember starting off, and I can just remember a few. Eduardo Phillips was a friend of mine, a wonderful leader, excellent surgeon, just a terrific person in that department. Lou Clayman was around, Eli Brown, Morris Brown, Stuart Hamburger before Eduardo, Mel Rubenfire, Joe Honnett, Hugh Beckman in ophthalmology, and the list goes on. And I think each of those individuals were equally intense about their commitment to excellence in the department, friendly, supportive, And I think they should all be recognized. All of the department chairs did a wonderful job. Thank you.
Well, thank you so much for your time, and we really appreciate this opportunity to talk to you.
It's been my pleasure. Thank you very much.